Good afternoon, everybody. My name is Francesco Messina, and in the next minutes, I'm going to talk about cytokine imbalance during targeted therapy for dermatologic diseases. So, as you all know, in the last decades, the therapy of psoriasis has made giant leaps forward. And this has been mainly due to the introduction of biological therapies, which are both very effective and very safe due to their very targeted mode of action. However, surprisingly, some of these drugs can also bear some side effects due to the perturbance of the cytokine balance. This is the case of paradoxical psoriasis or anti-TNF-induced lupus, as for TNF inhibitors. As you were talking about before, the yin-yang of TNF and interferon is the model based on the Taoist philosophy that explains how TNF inhibition might increase interferon and thus inducing this manifestation. But what about newer biologics? Are they devoid of such side effects? Let's find out. So, this is a patient with severe plaque psoriasis who came to our center and was treated with the anti-IL-17 ixekizumab and quickly got rid of psoriasis. But after 5 months, he came back with those lesions, eczematous lesions with prurigo features. So, was this just a coincidence? Apparently not. Since recently, case reports have described the occurrence of such adverse event in a small fraction of patients treated with anti-IL-17 agents. So, how is it possible that psoriasis can change into eczema since their pathogenesis is very different, Th17-mediated versus Th2-mediated? To investigate this issue, we collected biopsies from patients with these manifestations, and we analyzed their inflammatory gene signature using the nanostring technology, which allowed us to measure more than 600 genes. And then we compared it to other skin diseases. So, on the right, you can see the signature of psoriasis, where the red squares are for the upregulated genes which belong to the Th17 axis. On the left, instead, you can see the atopic dermatitis signature, which has its genes upregulated in the Th2 axis. What about anti-IL-17 induced eczema? These are patients with originally psoriasis who had a Th17 oriented signature, and now, as you can see, they switched so that they are really close to the atopic dermatitis signature. So, based on this data, we hereby propose the model of the yin-yang of the Th17 and Th2. So, under homeostatic conditions, these two vectors are opposite and balance themselves. But after anti-IL-17 administration, the Th2 vector takes over and can induce eczematous reactions. And so you might wonder now, what if the opposite occurs? What if we inhibit the Th2 pathway? Can we have psoriatic manifestation? And the answer is yes. As has been shown recently, dupilumab, so an inhibitor of IL-4 receptor, can induce psoriatic manifestations. And also in our cohort, we had some patients who underwent this change. And we analyzed their signature both before and after dupilumab administration. As you can see, this is the spider plot for their signature before, and it has a Th2 and eosinophilic oriented shape, meaning that it's quite similar, as you can see, to classic atopic dermatitis. But after switching to dupilumab and switching to a psoriatic morphology, their signature also switched to a Th17, Th1 oriented one. So, really like psoriasis. So, what's the mechanism behind all of this? The answer is that we don't know it yet. It's possible, based on previous publication, that TSLP might increase when IL-17 is inhibited, and then TSLP might drive eczema. while on the other hand, the inhibition of IL-4 might increase IL-23 levels, inducing psoriasis dermatitis. However, we cannot make a clear assumption yet, and further studies are needed. So to conclude, here we have proposed this yin-yang model that is a dynamic system driven by two antipodal vectors, Th17 and Th2, and selective targeting of one of these inflammatory pathways may displace the inflammatory balance. In this way, anti-IL-17-induced eczema and dupilumab-induced psoriasis are two sides of the same coin. So I end by thanking you all for your attention, and have a nice Congress.
Thank you very much. There's Jonathan, you have a question? There seems to be many questions for you.
Thanks very much. Nice talk. In our experience of IL-17 or indeed IL-23 blockers inducing eczematus, the patients have a history of atopy. And so I just wondered if your patients are atopic. So they've got psoriasis, but they've also got a history of atopy. And in those individuals, the phenomenon you've observed appears to be much more common.
Yes. Of course, I could not show all the data that we have. In the poster, there are more data available. A large portion of our patients had an atopic background, while just 1/3, on the other hand, of patients with dupilumab-induced psoriasis had a psoriatic background. So this might be another interesting point of reflection.
There's one over there, Joel.
This is a really interesting presentation. One of the questions I have is, I've seen this a fair amount in my own practice, and one patient who it occurred to very early when he went on IL-17 completely cleared his psoriasis and developed severe eczema, blistering over his skin, actually. Looked like dyshydrotic eczema, but all over. And so my question for you is, I mean, he is 6 or 7 years later still has an eczematous dermatitis, and he never had eczema beforehand. He doesn't have an atopic background. Have you seen this disease remit completely, or is there any of your patients that have persistent eczema after stopping the IL-17?
So we had some patients who really managed to overcome their eczema just also with topical drugs, while some others did not needed, of course, switching. By the way, some of them could remain under anti-IL-17, while others needed switching to anti-IL-23 mainly, and one also to dupilumab, actually. So there was this.
So the ones who switched, though, did their eczema fully resolve at some point, or are they still dealing with it?
Sorry,
did the eczema completely resolve when they switched, or is it still a problem for them?
So the majority actually, it remitted. In one of them, there was still something, but most of it just went away.
Thank you very much.